It is assumed that the patient is in dorsal recumbency for the methods of finding the adrenals described. With the patient in dorsal recumbency, the abdominal organs settle into predictable locations. Abdominal anatomy and abdominal surgeries are usually taught with the animal in dorsal recumbency. Subsequently, anatomy from this patient position is familiar to most veterinarians. Sometimes it is necessary to tilt the patient slightly to its right to improve transducer positioning from the left lateral side. In cats and in most dogs, the left kidney and the left adrenal are caudal to the last rib on the patient's left. In some dogs, the left kidney and left adrenal are cranial to the last rib, making it necessary to look for the left adrenal between the ribs. In cats and some dogs, the kidneys are very mobile and transducer pressure can displace the kidneys. If the kidney is pushed out of normal position by transducer pressure, an enlarged liver, or abdominal tumors, it can no longer be used as a landmark for finding the adrenals. From the left lateral sagittal position, the left adrenal is usually located between the cranial pole of the left kidney and the aorta. If the renal artery or vein is seen, the left adrenal will be cranial to them. A normal adrenal gland is usually hypoechoic and may be confused with a blood vessel. Remember that blood vessels should be anechoic. The phrenico-abdominal artery and vein will be in the center of the left adrenal gland. If color flow Doppler is used, the adrenal gland does not show color, but the phrenico-abdominal artery and vein will show color at the center of the left adrenal gland. The celiac and cranial mesenteric arteries originate from the aorta in the cranial abdomen. The celiac artery goes to the spleen, and the cranial mesenteric artery goes to intestines of the cranial abdomen. The cranial pole of the left adrenal gland is located directly over the origin of the cranial mesenteric artery. The left adrenal usually has a cranial and caudal pole in dogs and some cats, giving it the appearance of a peanut or dumbbell in a left lateral sagittal view. In some cats, the left adrenal only has one pole and may appear as a hypoechoic nodule. If both poles appear equal in size, you may measure the width of one pole or the other. Adrenal length is extremely variable and is usually not used as a reliable normal species measurement. Measure the width of both poles if they do not appear equal in size. In a lateral transverse or ventral transverse view, the left adrenal appears as a nodule that increases and decreases in size as you slide or fan the transducer cranially or caudally. Using cinematic loop, review your images and measure adrenal diameter or width at its widest point. In dogs, the adrenal width or diameter should not exceed 0.74 centimeters or 7.4 millimeters in large dogs weighing 60 pounds or more. Adrenal width in small dogs weighing 5 to 20 pounds should be about 0.5 centimeters or 5 millimeters. Adrenal width in medium-sized dogs weighing 30 to 40 pounds should be about 0.6 centimeters or 6 millimeters. Adrenal width in cats should be 0.4 to 0.46 centimeters or 4 to 4.6 millimeters. Borderline measurements in dogs or cats are probably normal. All measurements are subject to operator error. Measurements of the same adrenal by one sonographer may differ from those of another. It is easy to have the ultrasound beam slightly off-center of the adrenal and to make measurements that are not at the widest part of the gland. We are satisfied if the patient has no symptoms of adrenal disease and normal measurements of the right and left adrenal gland are similar. If the measurements differ considerably, we recommend repeating the measurements of both adrenals, using different methods if necessary.